My family, I think, is the reason I do it because I know how much I love them. And I just, I think if everybody feels the way I do, how much we yearn for the people we care about to have a long, healthy, vital life.
David, thank you so much for being here with us today. It's such a pleasure to have you.
Thanks, Haley. My pleasure.
I know you're a contributor to a lot of different sources, and you've written many different books and have a lot of different projects going all at once. I would just love to hear, what keeps you inspired and why you started.
I guess the answers are the same, really. It's very close to home. It's family. I think about my patients all these years, and what we have in common, is that human bond. I mean, when I hear about the things that make them sad or happy, it's the same stuff that makes me sad or happy. It's about people. It's about people who love other people and how health can make life better. And I feel that at home, and I see it in my patients, and I see the difference in the quality of a life when you and the people you love are thriving and when they're not. And so my own family has been my source of inspiration. They keep me strong because it's the sanctuary that I escape into. It's not easy out there. It's hard to get stuff done. Everything that you want to get done takes 10 times longer to go half as far, right? It's just the way the world works. It's hard. So we need a sanctuary where we can go and get restored and, where there's all that good stuff, in particular love. So my family, I think, is the reason I do it because I know how much I love them. And I just, I think if everybody feels the way I do, how much we yearn for the people we care about to have a long, healthy, vital life. Our children, my wife, in my case, a husband, a significant other. We all feel that. So I know what it feels like. I want to do something about it. So my patients have inspired me. The modern epidemiology we wrestle with has inspired me. Sometimes we're inspired by the enemy, right? I've got to go slay the dragon, and the dragon is rampant chronic disease. But I think ultimately the greatest inspiration is the why, the purpose in our lives, and that for me begins and ends with my family.
Wow, that's amazing. I can feel your passion when you talk about your family, and it seems like you guys do a lot of work together. You've created the Food Detectives, and your wife works on a website creating recipes for people. And your relationship with your children seems
it's
unreal.
Beautiful, yeah. We didn't really intend to work together per se. My wife's a neuroscientist, worked in neuroscience, but we have 5 children. When we got to kid number 4, everybody just needed too much of her at home. But then stuff happened. One of our daughters in school, there were issues with the quality of the snacks they were having at snack time, and one thing led to another, and the teacher said, "Okay, big shot, come in and do a nutrition program for us all." And I turned to my wife and said, "I don't know what to say to a bunch of 7-year-olds, for crying out loud." And the next thing you know, the first iteration of Nutrition Detectives was built because I knew the nutrition and she knew how to talk to the kids, basically. So we built it together. And then it really did become work we did together because then we rolled that into the standard operating procedures of the Prevention Research Center, and we implemented it in schools, and we tested it, and we published papers, and Catherine's a co-author on some of those papers, and we've revised it over the years, and then we got $150,000 in philanthropy to my nonprofit to turn that program into an interactive DVD. And so we spent several days at a production facility together working on that. And then everything else is kind of like that too. The kids, and we have 5 children, they were born into health as a family value. And people who think that this is hard, they ought to consider that pretty routinely, kids wind up being the religion of their parents, right? They may choose to go another way, but that's rare. The rule is, I grew up with it, it's what we know, it's what we do, whether it's religion or politics. Well, the same is true of health. If you walk the walk, if the only food you have in your home is good food, that's what your kids eat. So eventually, when they were old enough to understand, one by one, all the kids came to understand that health and vitality and living well was just part of their birthright. And they came to see as well that Catherine and I are committed, as a full-time job, to paying it forward to other people. And they just naturally wanted in on that. And so they participated quite actively as volunteers, and never gotten anything out of it. But very often the best way to reach somebody is by being somebody like them. And so in the case of a 15-year-old, they're much less likely to listen to me than they are to my 15-year-old son. So I'm enormously grateful that he's inclined to get involved and talk to his peers and help spread the gospel of good health, because, you know, I think ultimately it's that connection with other people that matters. So yeah, we're really fortunate that the kids have benefited from it. We have 5 beautiful, healthy children, which is a great blessing. And then they're good people who got involved and are helping us to pay it forward, because we want other families to experience these same benefits.
That's incredible.
Nice thing, yeah.
It's
good.
really beautiful.
It's really cool.
I get chills hearing you talk about paying it forward. I think that, you know, children, it's so important to have healthy children, because children really are the future. At Integrative Nutrition, you might be familiar with our concept of primary food.
Yes.
Everything that nourishes you that can't be found on your plate. And I know we talked about this a little bit in terms of your family.
Right.
But what is your standpoint on primary foods from a nutrition perspective?
Yeah, well, so the idea that there is more to nourishment and sustenance than just food choice per se, I think is a really important concept. So, you know, I think the word integrative in the name of the school implies a devotion to holistic health, right? I mean, health is not just one thing we do, it's everything we do and how they interact. And for example, we talk a lot about eating well, but what if you're not sleeping well? Well, then you're going to be tired and cranky, and you're going to eat junk because you're tired and cranky, right? It doesn't matter what you know about nutrition. So maybe you have to sleep well in order to eat well. And maybe you have to feel good about your life and your purpose, and maybe that means love in your life, and it's either there or it's not. And so, you know, if we think of everything that nourishes us as food, it's a lot more than just the food that finds its way onto the plate, but it has enormous implications for the food that finds its way onto the plate. We're more likely to eat well when we share it with the people we love. We're more likely to eat thoughtfully and well when we feel good about ourselves. Self-esteem figures in the mix. We're more likely to be healthy and care about our food choice when we're active. I think we have to sleep well, all of that. So I actually love that concept. I've been advocating for all the years of my clinical practice for a holistic approach to health. You know, it may very well be that it's your left ankle that's bothering you today, but you are not a left ankle. There's a lot more going on, and we really need to think about the whole person in the context of their life. And it's amazing how important things like purpose and love and relationships are, and how much they impact food. And the last thing I'll say, because, you know, again, you call it something different, but I've been there for a long time. Many times over the years, I've had patients come to me in the office and they've wanted to lose weight or they wanted to get healthy. And what they wanted me to do is, you know, I'm the nutrition guy. They've come to me, help me improve my diet. So, okay, I could do that. We start talking. I said, forget it. That's not the issue. The issue is a toxic marriage. The issue is a job you have. I mean, the issue is some other thing. And we've got to deal with that first. I mean, your diet will take care of itself once we deal with that, right? But there's a huge issue in your life. It's affecting everything about how you feel and how you function. So, you know, is that primary food? Yeah, I think it is. I mean, primary food is the stuff that feeds directly into the quality of our lives every day, right? And food is an important component, but it's just a component, so I like it.